Okay. Let me start off really quickly by saying one thing. I'm grateful for all of you for being here and being willing to invest some of your time. We'll do everything we can to make sure that it was considered well spent when we're done. Um, Also, we're running a little bit behind schedule, so I am going to attempt to fly through this information incredibly quickly and be as brief as I can. And you need to understand what a challenge that is. Those of you out there that know me know that the words David Edgell and brief don't often collide in the same sentence. But I am going to do my best to get you out of here by our 1 o'clock deadline. I want to go over some of the details of what you've heard a little bit about this afternoon, with a specific focus on the impact that the ABA Health Solution and what we're doing in this industry has on small business. As Todd said, all of us involved in this have at one time or another been small business owners. I've had the opportunity to actually work for startup companies up to relatively large companies, and then also run small businesses. So I've kind of got a sense of how benefits impact the world of employment. And the biggest reason that I'm here today is because we have the opportunity to do something that A, I enjoy doing, B, we can make a decent living at it, and we get to change people's lives. And I know that sounds melodramatic, but we really do. We can have a massive, massive impact for not just an employer, but that employer's employees as well. So the ABA Health Solution, we have a very simple objective. That is to reduce the cost and financial exposure associated with medical care. Now, the analogy I will use here, because there's two things to look at. There's cost, but there's also exposure. Have any of you ever gone to buy a car without ever even asking what the price is, just simply saying, what's my monthly payment? You probably want to know the price of the car, right? The salesperson, on the other hand, does not want you focused on the price of the car. They want you focused on that monthly payment because they can bury a lot of expenses in that monthly payment. We want to help lower your monthly cost, but we also want to close some of the financial gaps that exist with traditional health insurance. We put together a program that we believe does that incredibly well. The foundation of that program, there we go, is a combination of healthcare cost sharing bundled with supplemental insurance plans. Okay, most of you are familiar with supplemental insurance. You've seen the commercials for the duck, right? The Aflac folks. It's actually incredibly powerful stuff. The challenge with it is when you lay it on top of an already expensive traditional health insurance plan, it becomes cost prohibitive. We found the solution by bundling them and lowering the overall costs and making them accessible to allow us to use those supplemental plans to, again, close some of the financial gaps that exist. Now, there are additional components that we add to this to add additional benefits and make your benefits package incredibly competitive with the Microsofts of the world or the Adobes or the Intels, et cetera. The first one is primary and urgent care access. We'll talk a lot more about this in a few minutes. It's something that's relatively new to our solution, and we are incredibly excited about it because it's a game changer for us. 24/7 telemedicine access. Telemedicine, there's a recent study that shows that about 70% of primary care doctors' visits can be handled over the phone. So rather than having to bundle a kid up who's got an ear infection, haul him off to the doc, have him sit in the car waiting while you go to pick up a prescription, take care of that all on the phone, have somebody watch the kid while you go pick up the prescription. It's a lot more convenient. It's also a lot less expensive. Prescription discount plans and tools, dental and vision discount plans. We combine this all together into what we call the ABA Health Solution, and it is a wonderful, wonderful thing for yourself and your employees because it can save you money and make you more competitive. Now, there's been some talk about this concept of healthcare cost sharing. I want to talk about what it is and what it is not very quickly. Number one, it is not insurance, as Todd said. We like to refer to it as freedom from insurance. There's a lot of bureaucracy. There's a lot of regulation. There's a lot of things associated with insurance that make it incredibly difficult to navigate and lately have been making it incredibly expensive. We want to get away from that. This is not an insurance plan. This is simply a group of people who have formed a 501c3 nonprofit organization. These people are members of a community who share similar standards, most of those standards relating to our physical health and our approach to taking care of ourselves, eating reasonably well, exercising now and again, avoiding tobacco, illegal drugs, drinking responsibly if you're going to drink. Doing those things will help us maintain good health. Those are what most of the standards are formed around. Then these members who are part of this organization engage in what we call person-to-person sharing of medical expenses. And it's exactly what it sounds like. On a monthly basis, I contribute a certain amount of money to a fund. Other people are contributing to that fund. It's all held in an escrow account. There is a set of what we call sharing guidelines that dictate how money comes out of that fund to pay for medical needs. So I make a contribution each month. Others make that contribution. And when I have a medical need, money comes out of that account to cover those medical needs. We'll talk about the logistics in just a few minutes, but it literally is me making a contribution along with others and then agreeing that that money will be used to share each other's medical expenses. As Todd mentioned, this exempts members from the ACA individual health coverage mandate. It doesn't satisfy it. It simply says if you are a member of a qualifying healthcare cost sharing ministry, and we represent a qualifying ministry, you are exempt from the mandate. So there will be no penalties, no fines for not having a minimum essential coverage plan. Dramatically lower administrative overhead. Number one, it's a nonprofit organization. Number two, they're not tied to an image and a branding that, they want to go out there and be, have the biggest, tallest building downtown in the big city with their name on it. There's a lot of, let's just say that the target overhead or the target overhead percentage for them is about 12%. That includes cost of real estate, cost of employees, their benefits, all of it, 12%. It's a remarkably low number. Because it's not insurance, it operates with an entirely different vocabulary, and I don't want to spend a lot of time on it, but there's some things that I'm going to say that are going to confuse you if you don't have at least a basic introduction. In the insurance world, what you are familiar with as a deductible, we would refer to as a member responsibility amount. Conceptually, they're identical. They represent the first X number of dollars in a medical claim that is paid by the actual patient or the insured person. Okay? A monthly premium in the insurance world, in our world, is called a monthly contribution or donation. Okay? A covered expense is an expense that's eligible for sharing. A co-insurance, we call a second MRA, and a claim, we call a medical need. Now, there's some other differences, but with those in mind, we can communicate pretty clearly the rest of this presentation. So, how do medical needs get shared in this world? I want you to pay very close attention to this because it's going to look and feel a lot like traditional insurance because it was designed to look and feel like traditional insurance so that it isn't hard to understand and it isn't hard to navigate the world. Okay, step one. Member has a medical need, they select a provider or facility. We don't have a network of hospitals. You go to any hospital in the country, technically any hospital in the world, and receive your care. When you get there, you will present your membership card. It looks just like this one that I'm holding in my hand. You'll notice it looks an awful lot like a traditional insurance card. And when the intake people at the hospital get it, they're going to look at it, know exactly what to do with it. They are then going to get on the phone and call Altura HealthShare to pre-authorize any non-emergency procedures. If it's an emergency situation, you're going to need to notify the healthcare cost sharing company within 72 hours. Okay? Providers are going to send claims after the services are rendered to the healthcare cost sharing company. Healthcare cost sharing company is going to receive, or the member is then going to receive an explanation of sharing. You guys get a document when you have a medical claim. It's called an EOB. It's the exact same thing, but it's called an EOS because we don't pay benefits. We share in medical needs. Fair enough? All right. Payment's going to be issued to the provider from the escrow account. It's done. Does that look and feel a lot like the way things happen in the insurance world? That's by design. We didn't want it to be some convoluted, strange situation. There are medical cost sharing ministries where literally on a monthly basis, rather than there being money deposited into an escrow account and funds paid out, you would receive a notification from the healthcare cost sharing company saying you need to send X amount of your monthly contribution to this individual and X amount to that individual. It's a little laborious. Yeah, it's not something we want to get involved in. All right, so that's healthcare cost sharing. For those who are not really familiar with supplemental indemnity insurance, this is the AFLAC type programs. We use a company that we feel a lot more comfortable with. They don't do a ton of expensive marketing, which saves them overhead and cost. They pass that savings on to us in the form of lower premiums. We use two different kinds of plan: an accident indemnity plan that pays cash benefits for injuries resulting from an accident. That's the key, right? If you get pneumonia, that's not an accident, nor is it an injury. It's an illness, and it wouldn't be covered under this indemnification plan. You break your leg, that, on the other hand, is an accident and would be covered, okay? Why is this important, folks? 1 in 8 Americans goes to the doctor, the urgent care of the hospital every year, 1 in 8, to receive treatment for some sort of non-fatal injury. That's a huge number. That's a big, big exposure for you. And if you've got a high deductible health plan, you're on the hook for potentially a lot of money. So we want to close the gap. And how do we do it? Using an accident indemnity plan, here's some of the benefits that get paid out. You break your leg, they're going to write you a check for $2,000. Understand, that check is not being written to pay the doctor. Your healthcare cost-sharing company covers the doctor's expense. Now, you will have an out-of-pocket expense, a first MRA equivalent to your deductible. That money could be used to cover that, but you're under no obligation to use it for that. You can put it in your bank and go to Hawaii. Makes no difference, okay? You can see the schedule of benefits. There are some disability and accidental death benefits attached to the policy as well. But it's not a small amount of money, and it can add up incredibly quickly, and I'll show you what that looks like here in just a second. There's also a hospitalization indemnity plan. Now, this is going to be important for us because this is going to pay your cash benefit for hospital confinement. It doesn't matter if it was due to illness or accident. You go to a hospital, here's how it's going to work. And by the way, 35 million people are admitted annually, and the average stay is 4.8 days. Okay? That's 10% of the population is admitted to the hospital every year, folks. That's a big number. You have exposure there. Doesn't matter why you go. Could be a broken hip, pneumonia, appendicitis, stroke, makes no difference. The plan is going to pay you $1,500 for the first day of hospital confinement. It's then going to pay you an additional $200 for each day thereafter related to the same incident that you were hospitalized. So this average 5-day stay in the hospital, your benefit's going to be $2,300. Pretty simple to calculate. Make sense? Okay, so now we have a little understanding of healthcare cost sharing, indemnification insurance. Let's talk about how those two items play together to close the financial gaps and the exposure that you have right now. Right now in the state of Utah, a 5-night stay in a hospital due to illness is going to run you roughly $14,625. That's the average. That's according to Becker's Hospital Review. There's others that will show numbers that differ from that, but that's a reasonably good estimate. It can be a lot higher. It can be a little lower. The way this is going to work is you're going to have a first member responsibility amount. Now, I'm assuming that you're on our gold plan. This would be comparable to an Obamacare gold plan. You'll have a $500 first responsibility amount. That's your deductible. Very good. Your second MRA is going to be 25% of the next $10,000 for a total of $25,000. That second MRA would be equal to what in the insurance world? Coinsurance or copay, right? So now your gross out-of-pocket expense here is $3,000. So you go to the hospital, you assume it's going to cost you $3,000. That's a big chunk for most families. Would it bankrupt most families? Probably not. But is it going to hurt? Absolutely. Okay? So how do we deal with it? That's where our hospital indemnity benefit comes in. They pay us $1,500 for the first night, $200 a night for nights 2, 3, 4, and 5, for a total benefit of $2,300. That hurts. $700 doesn't hurt nearly as badly. That makes sense? We just closed $2,300 of that exposure, that gap that existed between what your insurance is going to do for you and what your actual costs are going to be. Fair enough? Okay. When your hospitalization is due to injury, that's when this becomes a lot of fun. We're going to assume a lower leg fracture, surgically repaired, 5-night stay in the hospital, roughly $20,000. Here's how it's going to play out. You're still going to have your first MRA, your second MRA with a gross out-of-pocket of $3,000. But the fun thing is, you're going to have a hospital indemnity benefit of $2,300 and an accident indemnity benefit of $5,725. How does that break down? $2,000 for the broken leg, $500 a night for each night in the hospital, $500 for your trip to the ER, $125 for crutches, about $100 for doctor's visits, about $400 for physical therapy. Again, this $8,025, that's not a check that gets written to the doctors, the hospitals, the facilities. That's a check that comes to you. What you do with it is your business. You put it in your bank account and spend it however you want. Okay? My recommendation, use it to offset that. But I want you to pay attention to this. This is no longer an out-of-pocket expense. Break your leg, you're actually putting $5,000 in your pocket. That's not a mistake. It's not a math error. That's actual reality. Now, please understand what I'm telling you here. You can make $5,000 for breaking your leg. That does not mean that if you're getting late on the mortgage payment, it makes sense to grab a ball bat, walk up to your son and say, okay, bud, you're taking one for the team. That's assault and it's also insurance fraud, okay? But, yeah, that's true. Well, yeah, they'll have enough to bail me out after I do it, right? Maybe what you do is you pay your younger son to break your older son's. See, I'm having some ideas here now. Okay. Any questions about how this works? All right. There we go. So let's talk about, boy, my clicker is not working well. We talked about some of the other benefits, one of them being primary and urgent care. I am so excited about this because one of the gaps that has existed for a long time is the cost of going to the doctor. And I had two options. I go with an expensive Obamacare Gold plan where I've got a $25 or $35 copay, or I pay my own doctor's visits and I get a major medical type plan and tie it to an HSA. Either way, I'm having to come out of pocket with a lot of money. Medallis has kind of flipped the world of insurance on its ear. In the insurance world, there is a financial incentive for a doctor to keep you sick. The more treatment that they provide you, the more profitable a patient you are. The more profitable a patient you are, the more money they make. Their compensation is literally tied to a formula that looks at the average value of each of their patients. They are incentivized to overtreat, keep you in the hospital longer than you need to. We have the gentleman that founded Medallis told us a story that just made my blood boil. He was at a hospital, or heard of a person who'd been admitted to a hospital up north, here in Utah, just the north end of Salt Lake Valley. Had been there several days, really probably didn't need to be admitted, but they did admit them, started administering a lot of IV fluids, overhydrated them, and this poor woman ended up in the ICU. She gets out of the ICU, is feeling a lot better, overhears a conversation between the nurse and her doctor that's going on outside her room. Nurse says, so we're discharging the patient today because, our bed count is really, really low. We're way below quota. Let's go ahead and keep her another day. They're financially incentivized to do that, okay? Dr. Rashat has flipped it on its ear. For a small monthly membership fee, which is part of our overall package cost, you have the ability to go in and receive primary and urgent care services at any one of 9 clinics from American Fork all the way up to Layton. They're extended hours clinics. Some of them open as late as 9 o'clock in the evening. They have on-site x-rays and labs. They can literally take care of broken bones. They can take care of all your strep tests, your influenza tests, your basic lab stuff. Any service that is performed there on a primary care visit basis, $10 copay. So for example, you have to get physicals. You go for well baby or well child exams, chronic disease management like diabetes. If you're dealing with hypertension, allergy testing, EKGs, all of that can be done in-house, and your total cost for that visit is going to be $10. They are awesome. I'd sit here and tell you a lot of stories. I'm going to tell you, well, hang on. Back up. Let me finish this. Urgent care visits are also $10. What kind of things are we talking about? We're talking about cough, sore throat, fever, broken bones, strep tests, breathing treatments, casting, splinting, stitches, you name it. Anything you would normally go to an urgent care center for, go on in and see the folks at Medallis. This costs you $10. I got pneumonia right after Christmas. I went into their Lehigh Clinic early January on an urgent care basis, received a chest x-ray, a nebulizer breathing treatment, a oral steroid, a shot of antibiotic, was written 3 prescriptions. The doctor took the time to not just explain what was going on, he literally drew a diagram of the inside of my chest on the paper on the exam bed, so I could really truly understand what was going on. Then he talked to me about treatment options and proposed a couple of different options and let me be involved in that process. Saw me, I was there, I was taken into the room inside of 5 minutes of getting there, and the doctor visited me within 10 minutes. All of that cost me $10. So then I decided, I'm going to go check out the Sandy Clinic just to see if I have a similar experience. So for my follow-up, I went up there. Again, chest x-ray, some lab work, all of this good stuff. No, my understanding is Medallis will not prescribe opioids. Not a place to get those. So anyhow, the net of it is I received fantastic care and paid $20 out of my pocket to do it. Pretty phenomenal opportunity for us. And it closes a huge gap. All right, some additional benefits. We talked about telemedicine, 24/7 access, don't have to leave home, no copay, and they'll literally call in a prescription for you if you need it. So a really, really handy way to handle about 70% of your doctor visits. We have some discount plans for prescriptions and some tools that we use to save you huge, huge, huge amounts on your prescriptions. There's a smartphone app that makes it so incredibly easy. It's not even funny. Come talk to me afterwards if you have questions. We have a dental and vision discount plan that'll provide savings from 15 to 60%. And there's providers all over the country. There's tons and tons of them here in Utah. So it works incredibly well. All right. Side-by-side comparison, then I'm going to cut you loose. Okay? How does this compare to a standard ACA, Affordable Care Act plan that's available in the marketplace today? And I'm going to compare it to an individual subsidized plan. I know that with employers, it's different. My experience has been employers end up paying a little bit more than what gets paid for by the individual market because they generally have better benefits. But just to give you a sense of how these plans compare, let's look at a ACA Marketplace Gold plan, and let's talk about that same lower leg fracture that I was illustrating earlier. You're going to pay a $1,000 deductible, co-insurance 20% of the next $19,622 for a total of $3,924. Net out-of-pocket expense under this plan is $4,924. Now, as compared to a $21,000 expense, $5,000 is not too bad, but that's going to hurt a lot of people. Okay. So how does that compare to what we're doing here? Under an ABA Health Solution Gold plan, you'd have a $500 first MRA, $2,500 second MRA with a gross out-of-pocket expense of $3,000, $8,025 for your indemnity benefits, and instead of a net out-of-pocket expense, you're putting $5,000 in your pocket. From a benefits standpoint, from a value standpoint, we believe that this crushes the ACA. Can I attach indemnity plans to my ACA plan? Certainly, for an additional cost. I'm going to show you the cost comparison, and I want you to understand that when I show you the Gold Marketplace plan, this is without anything like the supplemental indemnity plans, none of the Medallis membership, none of the dental discounts, things like that. Okay? Monthly cost for this plan for a family of 5 for the primary insured is 45 years old. Okay? Middle-aged person with 3 kids at home. $1,594. Now that is after applying a $427 a month subsidy. That's the monthly cost. Now, I know a lot of people who would gladly pay that because they've got some pretty significant health issues. But I also know a lot of people whose mortgage payment is not $1,600 a month. You have no idea how many people have walked in our office in the last 2 or 3 months after receiving their 2017 rate increases and told us my health insurance costs are now going to exceed my monthly mortgage cost. That's obscene.
So all my customer clients and area is public. That amount of money is still less than the average employer share of their family premium.
When I left my last job, which was 3.5, almost 4 years ago, my monthly cost was about just under $500. Well, we got paid every other Friday as opposed to twice a month. So it was 26. My contribution was $250 every 2 weeks, so roughly $500 a month. My employer, in addition to my $500, was paying in excess of $2,000. So my just my health insurance benefits were costing them $2,500.
Give them HSA person on the side.
Well, let's talk. It's funny you say you could whack that in half because let me show you the cost. I apologize, of our solution. That's it. But oh, geez, I keep hitting the wrong button. That's your cost. That includes everything I've described to you. That's the most expensive solution I can put together for a 45-year-old with 3 kids and a spouse.
Total cost, that's not just the employee's portion.
That's the cost.
The whole total.
Yeah. So if you decided you wanted to cover half of it and pass the rest on to your employee, which they'd be more than happy to pick up $420 a month to get this kind of coverage, and it's costing you $420, that's a pretty good solution as an employer, because you stop losing employees to the companies that are offering better benefits. You have a benefit package that actually exceeds what most employers are offering. The other thing that a lot of our employers are doing, who are already paying this kind of money or more, they're taking the savings and we're showing them how to reinvest it into 401ks, into group life, into other benefits that make their benefits package even more competitive and more attractive, allowing them to hire and retain better talent. Fair enough? That's our expensive plan. Yes? No. No, sir. For the employer, they can write it off as an expense. The employee's portion would be paid with post-tax dollars. But look at the difference in cost. You could pay them a cash offset to cover the tax liability if you wanted and still be saving tremendous amounts of money. Yeah, oh yeah, no. That's one of the things we're hoping that Trump is going to help us fix. Okay. All right, let's do the last comparison. This is the bronze ACA plan versus our copper plan. They're the most comparable. They're high deductible plans, okay? So, ACA bronze plan. Come on, clicker, go to work. You got a $5,700 deductible and a $1,450 co-insurance for a net out of pocket $700 or $7,150. Okay? This is their high deductible plan, generally attached to an HSA. Our copper plan has a $7,500 first MRA and no second MRA. Your gross out of pocket expense, $7,500. However, we have indemnification insurance of $8,025. So now, even with a high deductible plan, in that accident, I'm not hurt financially. So I can take the monthly savings knowing I still have some pretty good coverage. I'm still protected. This is the plan that I have for my family. Thankfully, we've never had to deal with reaching an out-of-pocket maximum. We're basically healthy. Now, if I'm 62 years old, am I going to take this plan? Probably not. Probably not. I want to lower that deductible a little bit, right? But right now, this is what makes sense for us. The costs, $684. That's after applying our subsidy on this side. $589 on this side. But look at the difference. It's a $7,600 swing in cost here. Now, one other thing you need to be aware of. This plan, I still have a $10 copayment when I go to see my doctor, or a $10 copayment when I go to see the urgent care doctor. I still have a dental discount plan. I still have all those benefits, none of which reside here. On this plan, my doctor's visits are subject to that $5,700 deductible. Now, they're really cool because after I've met my $5,700 deductible, then I only have to pay $35 to go to the doctor, which means you're paying your doctor's appointments. On our plan, your doctor visits are $10. Fair enough? Okay. Hopefully what I've done here today is shown you something that piques your interest, something that makes you go, I need to investigate this more fully. My intention today was not to make you an expert on the ABA health solution or health cost sharing. I wanted to whet your appetite. I would love for you to get with the person who invited you here today and go over the details and see what we can do to help improve your benefits situation at your company, save you money, and make you more competitive. Thank you again very much for your time. Drive safely when you're going back to work.